Hello everyone and welcome to the live lesson that we're doing today. It's great to see so many of you here from all around the world. I'm going to start by introducing myself. So my name is Bethan and I am the Academic Director here at Specialist Language Courses. Here at Specialist Language Courses, we're a premium provider and we help students to pass their OET. So if you are looking for support in passing your OET, we have a great range of courses that can help you, including our Reach OETB nursing and medicine courses. So these are two great courses designed to help you prepare for your OET. And in that course, you'll find activities on reading, listening, some speaking and some writing. So these are all activities designed to help you to get ready to take your OET. All right, so our lesson for today, we are going to focus on reading A, and we are specifically going to look at keywords and using prediction strategy. So if you've already started preparing for your OET and you've had some practice with reading A, these might be familiar terms for you. So specifically, what we're going to talk about is what are keywords? How can you identify keywords in the question? We're going to talk about what is prediction strategy, as well as the importance of using your language knowledge in reading A to help you to find the answer to the questions. All right, so we are going to do a little poll. So I have got some questions. I've got 5 questions for you about reading A. And what I'd like you to do is just pop your answers into the comments box and decide if each of these questions are true or false. So we have question number 1, I should read text A to D before I look at the questions. Number 2, I should skim the titles or subheadings of text A to D before I look at the questions. Number 3, reading A tests my ability to read for opinions. 4, in reading A, I need to use skimming and scanning techniques. And 5, exam strategies in reading A are not important. So pop your answers into the comments box, share them with our other attendees today. So which ones do you think are true and which ones do you think are false? Okay, great. I can see a few of you putting your answers in there. That's great. All right, great. So quite a lot of you have had a look at that. So let's take a look and compare your answers to our answers. So question number 1, I should read the text. Now by read, we mean read in detail, perhaps from beginning to end. As most of you have said, we think this is false. So reading in detail from beginning to end is not an effective strategy for reading A because you don't have that much time. Number 2, you should, instead of reading in detail, you should skim the headings, titles or subheadings to help you understand what each text is about. Number 3, reading A does not test your ability to read for opinions. That is reading C. Number 4, this is true. You need to use skimming and scanning reading techniques in order to find the answer. Remember that you have 15 minutes for reading A, so you need to use those techniques effectively and quickly to find the answers. And then number 5, exam strategies in reading A are not important. Now, we absolutely believe they are important. So if you're aware of strategies and steps that you can follow in reading A, this will help you to be successful. So exam strategies And having a procedure and an approach in place is really important to help you be successful in reading A under those time limits. All right, so let's talk briefly about some of the strategies and exam techniques you can use in reading A, and then we're going to practice those together today. All right, so it's a good idea to have some steps to follow. And reading A, there are some certain steps that you can follow to be methodical, to help you manage your time of 15 minutes to find all of the answers. So step one, we advise that you don't read the text. And again, remember, by read, we mean read every word in detail from beginning to end. Instead, as we've discussed, you look at them to see what each text is about, look at the kind of information that's included and notice any headings. Step two, you move on to the matching task, which is always the first set of tasks in reading A. And you can do this without reading the texts. So you can look at the question, you can look for those keywords and decide which text has that information. If you're not sure, then check. So check if necessary. So then step three, you move on to short answer questions and sentence completion questions. Now here, you need to decide what information you're looking for and which text to look in, and then use keywords and phrases in the question to help you find the answer. Now, it's important to remember you have 15 minutes. So if you cannot find the answer to a question, don't get stuck. Move on to the next question. All right. And remember, your paper is collected after 15 minutes, or for the OET at home, your access expires after 15 minutes. So we are going to look in more detail and more depth today at this particular step, step three, and we're going to look at how you can find keywords, how you can find the phrases in order to help you find the answers. So we're going to look particularly at sentence completion and short answer questions today. So keywords, one of the fundamental questions that you need to know the answer to is, what are keywords? So if you are doing some tuition with a tutor or you're attending any classes, you might hear your teachers talking about keywords quite a lot and underline the keywords. But what are these keywords? It's important that you understand this to help you select the most effective keyword to help you find the answer. So keywords are words or phrases in the question that you should use to help you find the answer in the texts. So this, you can do this in two ways. You can use the keywords to help you decide which text to skim for an answer. So you've got 4 texts, and to use your time effectively, you don't want to be skimming all 4 texts. You want to decide which text you should focus on, which you think is going to contain the answer that you need. You also need to use keywords to help you locate the answer. So first of all, you've got your keyword to help you decide which text, then you go to that text, and then you use other keywords from the question to then help you look through that answer to find, to look through the text to find the answer that you need. So this is another question that we often get. How do I know which keywords to underline? So keywords to underline, you're often tempted to underline all keywords because often we find that the keywords, all words are important. However, in order to manage your time effectively in reading A, you need to know which words are going to be the most helpful for you to find your answer. So usually you would look for meaning words. So looking for meaning words as opposed to small grammatical words is usually the most helpful way for you to find the answer. So let's take a look at an example of what these meaning words are. So we have got some questions. So we've got 2 examples of some gap fill and sentence completion questions on the screen. And we've got our titles here. So we're just going to look at these two questions to work out what the keywords could be in these questions. So remember, we're looking for meaning words. So meaning words could be nouns, for example, classification, or a noun phrase, burn injury. Meaning words could be adjectives that modify our nouns. So here we've got an adjectival phrase, third degree, to add meaning to our noun. They could be verbs. So here we've got depends, cause, recover, experience, or they could be quantifiers. Now this is quite an important one. So quantifying phrases will really help you to find the answer. So we've got a great deal of or amount of here. And the other type of keyword that you need to be aware of are topic words. So what we've called topic words. Topic words are those words in the question that you can use to help you decide which text you should look in. So here we've got classification and third degree. We can look at these two words and decide which text we're going to read in more detail. Now notice the words that are not usually keywords here. So we've got some prepositions and we've got articles perhaps are not usually those keywords. We quite often call them those grammar words, the words that we need in order to make our sentence grammatically accurate, but they may not help you when you're looking for an answer to a question. Not always, but usually. So we usually focus on meaning words. Now, as you may, we've got lots of colors on our screen here, but as you may know, you're not allowed to use a highlighter in the OET exam. So instead, when we're looking at our keywords today, we're going to start underlining and circling as you might do in the exam. So here we've got nearly all of our words underlined, which is probably not an effective strategy in terms of your time. So let's take a look and let's look at which of these words are important to help us find the answer. So we've got our questions and we've got our strategy. So we've got our keywords here. And now our next step is using these keywords to decide which text we need to scan the answer. So we've got classification is one of our keywords here. And we've also got third degree burns. So in the chat box, please have a look and decide which text do you think you need to read in order to answer questions 6 and 7. Let's get your ideas in the comments box. Just using the titles you can see on the screen. All right, so we've got a few of you. Yeah, great, thank you. So we've got 6, we've got classification. So classification is likely to be A. We're looking, the text suggests that they're going to look at different depths and different classifications of burn injuries. And number 7, third degree burns, patients recovering from third degree burns. This could be A, possibly C. So if we're not sure, we would perhaps make a note in both of them. Go to text A first. If we can't find the answer, then have a look in C. All right, so we've got some of our keywords and we've decided which text we think we might find them in. So this idea of keywords is important, and it's something that you need to do in your training when you're getting ready for reading A, so that when you come into the exam with a 15-minute time limit, you are able to do this very quickly. You're able to quickly identify the keywords, the meaning words, and the words which will help you to find your answer. So let's take a look at some examples. So in the chat box, I'd like you to put which one do you think is a better example of underlining keywords? We've got A, B, or C. So here we go. into the comments box, which do you think is a better example of underlining keywords and why? All right, so pop your ideas into the chat box. Which one, A, B, or C, do we think is the better example of underlining keywords? Okay, great. So I can see some of your answers there, which is great. Thank you very much. All right, so we're going between, most of your answers are ranging between A and C, not many people choosing B. All right, so let's take a look. We think A is probably the best use of your time. You've got some, you can see there's circles here. Perhaps this person has used circles to help them decide which text, and then key meaning words have been underlined here. B is probably not enough. There's only one phrase underlined in each of the questions, which means that perhaps there isn't enough to help you to find the answer. And C has got quite a lot underlined. So perhaps this is too much. So remember that those keywords are the words that are going to help you scan for the answer. So if you underline too much, then it may not be that helpful for you. All right, so let's take a look at prediction strategy. So some of you might be familiar with this if you've been preparing for your OET already, or you're familiar with exam strategies. But let's just run through what we understand by prediction strategy. So what is prediction strategy when we're looking at OET exams? It means that you are predicting the word or the type of word that you need to scan for. So you use your understanding of English and your knowledge of grammar to help you decide what kind of word you're looking for. And then this should make it easier when you scan for the text if you know what you're looking for. How can you do this? So you need to use your English knowledge and your grammar knowledge to predict the type of word. You need an awareness of the different word types and their function. So we've looked at nouns, verbs, adjectives, and you need to use your grammar knowledge to understand sentence structure. So for example, if you see a phrase is likely to, then you can predict that what comes after that will probably be possibly be a verb. All right. So in order to do this, if you're looking at gap fill questions, you need to use the words around the gap to help you. So around the gap is quite important. So remember, you need to look before and after the gap. And for short answer questions, you'll be using keywords in the question. All right, so let's take a look at some of these examples, and then I'm going to give you a chance to answer some of these questions using the strategy today. So coming back to our questions 6 and 7. So we've got our keywords here. We've circled the words that we use to decide which text. We've decided which text. Now we're going to use our strategy of using our grammar knowledge to predict what type of word we're looking for. So in number 6, we look at our question. Classification of burn injuries depends on the amount of caused. So we look at this and we look at the phrase, the amount of, so we want to know the amount of what or how much of what. So here we use our grammar knowledge. We want to know the amount of what, so we know this is a thing, and we know that things are usually nouns. So we know that we're looking for a noun or a noun phrase here. In number 7, we have got patients recovering from 3rd-degree burns are likely to experience a great deal of shrinkage and of their skin. Now here we look at this pattern. We know that shrinkage is a noun, and we've got a linking word here, and. So we're looking for another noun. So we've got shrinkage as a noun. So we're looking for the second noun here. We can assume with our grammar knowledge that there'll be two similar word forms. So for number 6, we're looking for a noun, the amount of what, and number 7, we're also looking for a noun linked to shrinkage of the skin. So we've got all of our grammar knowledge here that's working while we're analysing the question, looking at those keywords, and then we take this knowledge and we look at the text to find our answer. All right, so we have got number 6, our sentence completion. We've got our keywords here. We know we're looking in text A. So let's take a look at our text. So we know we're looking at classification and the amount of caused. So I'm going to give you a few moments, and I'd like you to scan the text, and I'd like you to find the answer. Please, can you pop it into the comments box? All right, so I'll give you a few moments to scan the text and then see if you can find the missing information here. All right. Great, so scan through the text and see what that missing thing is, what that missing noun phrase is. Okay, great. So for number 6, we look at this particular section. Burn injuries are classified, so we've got classification, classified according to how much, and again, we've got our synonym, how much, amount of, and tissue damage. Good, okay, so we've used our keywords, we've used our prediction strategy to find the answer. All right, so let's take a look at number 7 together. So we know that we're looking for a noun, and we know that we're looking in 3rd degree burns and what goes with shrinkage. So here is our text. We know that we're looking at 3rd degree burns, which we've got here. So take a look, and what is our missing noun? Shrinkage and what? Pop your ideas into the comments. We'll take a few moments to scan through and look for that noun that we need to complete our sentence here. All right, great. Okay, great. So we're looking particularly at this section here, and we have got our answer is scarring. All right, so we've got our noun as our answer there. All right, now something else that is important is using your grammar knowledge to check your answers. So you've used your grammar knowledge to predict the type of information that you need, and then you've used that knowledge to help you scan for the answer. And you also may need to check that you've got the right answer. So again, you can use your grammar knowledge to help you do this. So we have another question on the screen here. So we've got question 12. You should consider leaving undisturbed, as these may help prevent infection. So we've got our keywords, leaving undisturbed. So we're looking at which text we need to check first. And we've got our keyword here, prevent infection, which then leads us perhaps to probably to text C. We're looking at preventing infection management for burns. And then we've got our keywords in there. Now, we're going to use our grammar knowledge, our prediction strategy here. We can see that we've got a verb phrase, and undisturbed is an adjective. So here we want to know what do you need to leave undisturbed? So we know that what is a thing, and we probably need a noun or a noun phrase. Now, as I've mentioned, it's really important that you read the keywords before and after the gap, as this can also help you to choose the right word. So looking after the gap, we've got this keyword here, these. Now, using our grammar knowledge, we know that these is a word that is referred to used to refer back to another word. And as it's these, we know that this is a plural word that we need. So make sure that you read before and after the gap to help you find the answer. So we now know that we're looking for a plural noun in here. All right. So let's take a look at our text. All right. So you've got your text. You should consider leaving undisturbed, as these may help prevent infection. So take a few moments to look through the text. What plural noun can you find to go into this gap? Write your ideas into the comments box. Okay. All right, great. So I can see a few of you answering there. That's great. So we're looking particularly at point number 7. And if we look at 7a, we find that we're reading in the right place. So some suggest leaving, so one of our keywords is the same here, leaving intact because the blister acts as a barrier to infection. So here we've got barrier to infection, prevent infection, but we know that it needs to be a plural. So this, the blister, is not quite the right word. And the one we want to choose is blisters. So it fits grammatically into our sentence there. All right. Now, another thing that you need to be aware of in reading A, which some of you may have noticed, are synonyms. So synonyms, words or phrases with a similar meaning. Now, when you are looking at questions, one of your strategies, as we've talked about, is to find the keywords in the question and then scan the text for those keywords. However, as we'll see, some of you may know, you won't always see the same words in the question as the text. So if you only scan for these keywords here, you may not find them and it may take you longer. So you need to scan for keywords and also notice synonyms or paraphrasing. So don't expect exactly the same words every time. You need to be aware of paraphrasing. So we've had a look at question 7. We know our answer is scarring. So now we're going to look at some of those synonyms that helped us to find the answer. So we know that we are looking in this section. Let's take a look and see if we can find what is the synonym for recover from and what is the synonym for a great deal of shrinkage. So take a look at the text and pop your ideas into the comments box. What is the synonym from the text for recover from? And what is the synonym for a great deal of shrinkage? Okay, great. So pop your ideas into the text, into the comments box. Great. Okay, good. Good. Okay, great. So you've all scanned to find those answers there. So we've got recover from, in this context, is healing. So we've got recover from and healing associated with, and then a great deal of shrinkage a great deal, we've got considerable, and shrinkage, we've got contraction. So you need to have an awareness of synonyms relating to the words that you find in the question. So let's take a look at another example here. So we know our answer for number 12 is blisters. And we've got a couple of words, keywords to have a look for and scan for the synonyms. So we've got undisturbed. So we're going to look for a synonym for undisturbed and also prevent infection. All right, so we know that we're looking at point 7. So what can you find for undisturbed and also prevent infection? So perhaps not a direct synonym, but a paraphrase here. So pop your ideas into the chat box. Okay, great. So what do we have for undisturbed and then prevent infection? Great. Okay, so I can see a few of you putting your answers there. So undisturbed, we have got leave intact. All right. So undisturbed or leave intact down here. And then prevent infection. Here we've got a paraphrase as a barrier to infection, or acts as a barrier to infection, as a synonym or a paraphrase of those two phrases there. So when you are scanning for your answer, make sure that you're aware of those synonyms. All right, so let's take a look at some more synonyms from our text. So into the comments box, I've got a short task for you. So you have got words from some of the questions, 1 to 5, and you have got the synonyms from the texts A to D. All right. So can you match 1 to 5 with A to E? Write your ideas into the comments box. So you can write 1 C, 2 D, etc. There's no need to write the full words. So pop those into the comments box and let's share our ideas with everybody in the class today. So again, you can use your grammar knowledge here. Notice which ones are verbs, which ones are noun phrases. All right, great. Okay, great. Okay, great. So great. So let's have a look at those answers. Thank you for putting those answers in. Let's have a look. So we have number 1 is a verb, so take off or remove. Number 2, we have attach a drip, and perhaps also IV would be related here, or cannulation. Number 3, we have try or attempt. Number 4, we have pain relief. So we've got an example of pain relief as analgesia. And number 5, we've got reevaluate and review. So 2 verbs there. All right, so we've had a look at gap fill questions and how you can use your grammar knowledge and prediction strategy to help you answer those questions. Let's take a look at short answer questions and how you can apply these strategies to short answer questions in reading A. So in short answer questions, you will find in the question, you will find In the question, you will find what kind of information you're looking for, and you'll also find the details to help you locate the information. So here, what kind of information you're looking for. Here we've got that information, what factor. So we know that we're looking for a factor. And then we've got details to help you locate the information. So we've got our details here, mixed depth burns, determines, and local treatment. So using this information, we need to decide which text to look in. So text A, if we're looking at burn depth, mixed depth burns, we're going to be looking at text A. And then you need to use all of this information to scan for the answer. So not forgetting your prediction strategy. We know that we're looking for a factor, and a factor we can predict that we're likely to need a noun or a noun phrase here rather than a verb. What factor? It's a factor, it's a thing. What is it? What is that factor that helps us? All right, so let's take a look. So we've got our keywords. We know which text we're looking in. So then we're going to look in the text. We're looking for our answer. In the case of mixed depth burns, what factor determines the local treatment to give? All right, here is our text. So remember, we're looking for mixed depth burns. So we're going to be focusing our attention on number 3, mixed depth burns. All right, so for question number 14, what can you find? Can you find your answer? What is the noun or noun phrase that describes the factor that we're looking for? Okay, good. Interesting. All right. So when you're choosing your answer, just be careful that you refer back to the question. All right. And make sure you choose the right part of the answer. So we're looking here. Resuscitation should be based on the total of second and third degree burns, and local treatment should be based on the burn thickness at any specific site. So most of you have identified this correctly, burn thickness. However, when we come back to our question, we want to know what factor determines the local treatment. So the factor is just thickness, all right? So we don't really need this word burn because it's already implied in our question, okay? So let's take a look at another example. So we've got our steps to follow for question 15. We need to know what kind of information we're looking for. So take a quick look at question 15 and tell me, what kind of information are we looking for? What's that key phrase in question 15? What kind of information are we looking for? Pop your ideas into the comments box. Okay, so in the comments box, we're looking, excellent, you've discovered this, the maximum number of tries. All right, so we're looking for the maximum number of tries, so we know that we're looking for a number. We then look at our keywords to help us decide which text we want to look at. So the maximum number of tries recommended for attaching a drip at the scene of a burns incident. So we're going to look at text B. And we know that we're looking for a number, the maximum number of tries. All right, so let's take a look at our text and let's find our answer. All right, so take a look at our answer. we're looking for the maximum number of tries recommended for attaching a drip at the scene of a burns incident. Remember that you may also need to look for synonyms. Remember those synonyms that you need to scan for. So scan for drip or a synonym, and attaching or a synonym. And again, we're looking for tries or a synonym. Okay, great. So a lot of you have found that there. So we're looking here, and we are looking particularly for a number, and our number. We've got quite a lot of numbers here, but the one we want is 2. So we can see cannulation, synonym for attaching a drip, and attempts as a synonym for tries. So our answer to 15 is 2. All right, so let's take a look at one more question together. So we have got question 16. So question 16, we need to know what kind of information you're looking for and details to help you locate that information. So if we read question 16, how much resuscitation fluid should a child receive per kilo over 20 kilograms? So here we've got how much resuscitation fluid. So we know that we are looking for some sort of quantity here. And we know resuscitation fluid, we can tell that we're going to be looking in text B, fluid resuscitation. And our keywords to help us when we're scanning is child, and then this statistic here per kilo over 20 kilograms. So we want to know how much. We're looking for a quantity, so it's likely to include a number. And we need to remember that this information is per kilo. So this is quite important here. If you've got per kilo, make sure you pay attention to that per kilo, because you may have total and then per kilo. So just make sure you pay attention to that. All right, so let's take a look at our text. All right. So take a look at the text, take a few moments. Remember, we're looking for child, so we immediately focus our attention onto this section of the text here. We know that we're looking at information about children. So take a look at that section of the text and see what you can find. Okay, great. So good to see, but we've got some answers here. Let's have a look. So we know that we're looking here. Notice there's quite a lot of quantities here. So you need to read quite carefully for which of these numbers you need. So which a child over 20 kilograms. So if we look at the information here, for the first 10 kilograms, and then we're looking at this section for the next 10 kilograms, we're looking over 20 kilos. So we're looking at this section here, and we have got 20 mils. Now notice that in the question, we've already got per kilo. So in our answer, we don't need 20 mils per kilogram exactly as it is in the text. All we need is 20 mils. So just make sure that you read the question carefully and you're choosing the right part of the answer. As we saw before for burns thickness, you had 2 possible answers, and the only word you need really is thickness. Now, a few of you have asked if you write, for example, if you write 20 millimeters per kilogram or burn thickness, would the answer be wrong? The answer is maybe accepted by OET. So, but you really need to carefully look for what the answer to that specific question is and try to avoid repeating any words from the question. All right, so let's take a look at our final question together. So we've got 17. So we're looking for the kind of information we're looking for. we're looking for the percentage of the body. We know that we're looking in fluid resuscitation, so we know that we're looking in text B. And we've got some keywords here. So before attaching fluid resuscitation drip to a 9-year-old burns patient, we've got the age, so we know we're going to be looking at children. We need to know what percentage of the body needs to be affected. So we're looking for a percentage or a number here. All right, so here is text B. So let's take a look. We're looking for percentages here. So we're looking in that first part, fluid resuscitation, children specifically. So take a look and see what percentage, what is our answer here. Okay, great. So some of you are writing this as numbers, some of you are writing it as words. Okay, so our answer is 10%. Now, if you write it as words, it's correct. If you write 10%, it's correct. However, to be on the safe side, it's a good idea to copy what you can see in the text. And in the text, we have got this written as a number. So remember that your answers can be a number or words. So the idea in reading A is you find information in the text and you record it quickly. So to be on the safe side, write what you see in the text without changing it. But if you did write 10% as words, it's likely that you would still get the points as it's the correct answer that you found. All right, so in reading A, for short answer questions and sentence completion, decide what kind of information you're looking for. Use those keywords from the questions. Use your grammar knowledge to help you to decide what those keywords are and which words will help you to look what kind of information you're looking for. Use the words from the sentence to help you locate. So you've got using the keywords to decide what kind of information you're looking for, prediction strategy, using those keywords from the sentence to then help you locate the answer in the correct text. It's a good idea to decide which text to look in to help you save time and use your time effectively. It's really important that you don't waste time in reading A. If you can't find the answer quickly, move on. You may well find the answer later on in the paper when you're looking and scanning, looking for another answer or scanning the text for something else. But if you spend a long time on a question, then you'll be wasting time and that you just don't have in reading A. Make sure you're careful of your spelling and make sure you copy the words accurately. So if you find the right word, but you copy the spelling incorrectly, then you may not get a mark for that particular question. So some common mistakes that we find students often make that you should be aware of in reading A is spelling. Make sure you copy the words carefully. Reading the text first, and again, by reading, we mean reading in detail from beginning to end. You don't have time to do this. Spending too long on one question can be an issue. If you're not sure, move on to the next question. Come back to any questions you're not sure about later. Repeating things that are stated in the question in your answer. So, for example, we have what is the maximum dose allowed? If you write 10 milligrams maximum, you're repeating a word from the question. So the answer is correct, but you have this unnecessary word. So you may lose a mark if you're writing unnecessary words. You may still get the point because it's correct, but just be careful that you're only answering the question that is asked. And make sure you don't read. One of the other problems is people not reading the question carefully. So for example, what is the maximum dose allowed? And your answer is 8 to 10. That's not the maximum. That's a range. So you need to make sure you read the question carefully and answer the question with information from the text. So top tips: make sure to be successful in reading A, make sure you're methodical, practice the steps, practice the recommended stages, and practice that those exam strategies to help you be successful in reading A. And while you're preparing for reading A, follow these steps, do this repeatedly with exam practice papers, and speed up. So all of this information can be quite a lot of detail that you feel that you may not have time for in reading A, but your preparation time you should spend on training in the strategies and speed up, so that when it comes to exam day, you're able to go through the questions and circle and underline and choose those keywords quickly and efficiently. And make sure you don't waste any time. All right, so for those of you who are currently preparing for your OET, as we've mentioned, we have some great courses to help you prepare for your OET. So as well as our Reach OETB courses, which is an online self-study course, we also have a correction service and a practice test, some practice tests. So practice tests are great if you're close to taking your exam and you want to really practice your timing. It's a really great course that could help you to, even if you've taken the OET before, it can help you to refine your skills. Or if you're new to OET, then it's a really great resource or tuition for you to help prepare for taking your exam and getting ready for taking the exam. Also, you can head over to our YouTube channel, where you'll find lots of other free tips and strategies in helping you to prepare for your OET, as well as some live lessons. And also make sure to follow our social media channels for upcoming news and anything that we've got planned to support you with your OET journey. All right, so that is all we've got time for today. Thank you very much for coming along. It's been really great to see you, and we look forward to seeing you again in the future. Bye-bye.